Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites viewmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the Empyema Diagnosis and Treatment. Empyema is defined as the collection of pus in the pleural cavity due to the infection reaching the pleura directly from the lungs by trauma, ruptured pulmonary abscess, etc. Spread of infection from the surrounding structures by contiguity or lymphatics, as in pneumonia, tuberculosis, suppurative lung disease, osteomyelitis of ribs or vertebrae, subdiaphragmatic abscess. Hematogenous spread may occur as in pyemia or septicemia. Organisms causing empyema are the common organisms causing the infection are Staphylococcus, which is resistant to penicillin and other antibiotics. Infection with the pneumococcus, streptococcus, H. influenza, etc. are less common diseases of respiratory tract. Clinical features may be associated with impetiginized scabies, infected vaccine sites, pyoderma, furunculosis and chronic otitis media in debilitated children. Many children may present with non-specific symptoms like diarrhea, fever, etc. without any clue to presence of pus in the chest. Often predisposed with debilitating diseases like measles, whooping cough, etc. Associated with fever, toxemia, respiratory embarrassment, cough, loss of weight and progressive pallor. Examination of chest may reveal diminished chest movements, fullness or edema or chest wall, impaired percussion note, displacement of the apex beat and trachea to the opposite side, and diminished air entry may be elicited. In small infants, even small amounts of fluid is enough to cause respiratory disability. Breath sounds from the healthy side are sometimes transmitted to the affected side of the chest due to small chest. Asymmetry of the chest is more marked in infants than in older children due to yielding thoracic cage. Staphylococcal empyema may often present as a pyoneumothorax. In a long-standing empyema, anemia, weakness, deformities of spine like scoliosis, bronchopleural fistula and clubbing of nails may be present. Diagnosis. Diagnostic tap and withdrawal of pus is confirmatory. The aspirated material is examined by means of a smear and culture and sensitivity. X-ray helpful in confirming the diagnosis and subsequent management. It may show uniform homogeneous opacity with the heart and mediastinum displaced to the opposite side. If thoracentesis is performed before the X-ray, fluid level indicating the presence of air. Occasionally loculated empyema may be present with the typical Bidger shadow. The WBC count, it is often elevated up to 15 to 75,000. Treatment. Thoracentesis to relieve a respiratory embarrassment. Specimens are collected for gram stain and culture and sensitivity tests. Antibiotics depend upon the results of sensitivity of the organisms and continue till clinical improvement and the pleural fluid becomes sterile. If culture report is pending, crystalline penicillin 5 lakhs every 6 hours or cephalothrine 100 to 300 milligrams per kg IV or chloramphenicol is given. Institution of closed intercostal drainage connected to an underwater seal. By this means the pleural space is emptied and the lung is allowed to expand rapidly. The drainage is continued for 3 or 4 days until all pus has been drained completely. If the lung does not expand, suction under pressure may be required by Robert's suction pump. Measures to improve general condition: oxygen inhalation, physiotherapy by breathing and postural exercises to expand the lung completely. The usage of enzyme agents like streptokinase is controversial. Many clinicians feel that their installation precipitates the hemorrhage and induce high temperature. Dyspnea by cyanosis. Surgery. Indications: when the diagnosis is delayed and absorptive capacity of the pleura is defective and there is still an accumulation of purulent material after the disease has lasted for more than 4 to 6 weeks. Despite adequate therapy, that's all about the empyema, and in the next video I will discuss about some other disease. Thank you.